ladies and gentlemen. This is Dr. Ben with Leading Edge Chiropractic, and I am here with my friend Ingrid LeVasseur. She is with Inner Image Clinical Thermography. This is a new series of videos I'm going to be putting out, basically talking to like-minded health professionals in the area for people that are conscious about their health and want to make some positive changes. So, Ingrid, welcome today. I'm happy that you're here.
Thank you, Dr. Ben.
And so I just kind of want to talk to you. People are really curious about knowing about what thermography is.
Yeah.
And so why don't you just tell me a little bit about, who it is that, who you are, what you do, how you got into it, and then kind of get into what thermography is.
Sure. Actually, I learned about thermography from my chiropractor at the time, no less. I said, I'm looking for something that's like a mammogram but isn't a mammogram.
Mm-hmm.
It's pretty much was the terminology I used. And she said, well, there's something that we've heard of called thermal imaging, but we don't know much about it.
Cool.
And so I decided to find out much about it and realized that there was really nobody in the area offering it to women, and I thought that was a crying shame. Oh, yeah. So I figured out that I must be the person who was supposed to do this. Right. So over 10 years later, I'm still happily imaging breasts and more.
That's great. And so what is thermography for people watching? Great
question. So a lot of people are hearing about it online or reading about it, but basically the body is always giving off heat. We know that. We touch ourselves, so we can feel that warmth. If you have a cut or something, you might notice that cut feels hotter as the body's trying to heal and knit that tissue back together. So thermal imaging is basically recording and making a picture of the heat that we naturally give off. So we consider ourselves to be 98.6 as a temperature. But our body has all sorts of temperature variations, and you might notice it even in yourself, where one part of your body is warmer than another, or maybe your fingers are cold, but you're near the chest is warm. Right. So there's much more subtlety in it than that. So we're basically able to image the heat that the body is giving, and the heat that the body gives off is basically giving us what the metabolics of the body is, or what the activity of the body is. So we're not just looking to see is there a lump or to see what the bone looks like. We're actually trying to find out what's the functioning of that particular body part. In this case, primarily the breast imaging. So what's the functioning within the breast? There's a lot going on that is not just, is there a lump or no lump? There's lots of activity in there.
Right. So if you're looking at breast health, people are watching this video, maybe they're thinking about, do I do a mammogram? I've heard a little bit about this thermography. So when you're measuring breast tissue for the heat using thermography, what are you checking for there? What's going on?
Sure. So first I'd like to say that this isn't a replacement for mammograms. That's really important to understand. Right. But mammograms don't replace thermograms either. Mammograms can't do what this camera can do, and we don't do what a mammogram does. So it's two very different types of screening. And it is screening. We're not trying to diagnose anything. We're just trying to screen. But some of the things that we are able to see within the breast tissue is we can tell if there is fibrocystic breast. Some women complain that my breasts are so lumpy, I don't even like to touch them. So that lumpiness can oftentimes be fibrocystic. But we can tell not only is there fibrocystic activity, but also is that activity inflamed. Inflammation is a big key here in all of our health.
It's a precursor to a lot of different things.
Absolutely. Yes. And we can really tell, does that fibrocystic activity seem to be fairly stable and calm, or is it really in a more angry place, I like to call it. The other thing that we can tell from the imaging of the breast is if there might be estrogen dominance. So estrogen dominance can certainly be rectified, with hormone balancing. And another thing that we're able to see is within the armpits, you have 17 lymph nodes that are directly near the breast tissue. And we can tell if those lymph nodes are congested. So if you think, well, why would that be important? If you think if you have your nose is congested, you can't breathe, it's difficult to function, you're breathing through your mouth, and that chronic congestion is not healthy for your breasts either, for that region. So I liken the lymphatics almost to our sewer system. I know that
Right.
sounds,
No,
but it is.
yeah.
It's the way that the cells are, it's the passage for the waste products that come from the cells. And to have that congested and blocked up is not necessarily the healthiest place for the breast to be. But that can be rectified too with a very specific type of massage treatment.
Right.
So all of these things that we're able to notice within the breast can be rectified at an early stage. They don't have to be just lived with and continue to get worse.
Right. Well, great. And so is this something that's covered through insurance?
Almost never.
Okay.
So let's just say never.
Okay.
And if there will be an occasional plan that might be a nationwide plan that will cover it, but
Right.
gosh, it's very affordable, I guess is the best thing to say.
Okay.
And the beauty of it, in my mind, from it not being covered by insurance, is that you're able to do this when you want, how you want, as often as you want, or as infrequently as you want. So the cost for it is $175 in my office. It might vary from place to place, but that's in the range. The cool thing about that is that I send these images to medical doctors who read and interpret the scans. And the interpretation by those doctors is included in the price.
Oh, that's
so
great.
there's no separate bill that will come back from the interpreting doctors.
Right.
So once you've paid me, you're done, one and done, and you will get a written report by a medical doctor.
Important. A lot of times
Yeah.
there's, maybe there's some tests and you pay for the test, but that's like, well, then if you want to get the reading, it's like, well, I'm doing the test because I want to know what's going on.
Right, exactly.
So that's super
yeah.
important.
Yeah, so this is included.
And when you're talking about insurance too, a lot of people will dictate their health based on what their insurance provides, and it's so sad to see that they walk around sometimes with their insurance card almost like a debit card, waiting to swipe it, and that it's going to pay for things. But a lot of your insurance companies won't pay for, for yoga or for you to go to a class to meditate to get organic food.
That's right.
So it's sometimes there's just some out-of-pocket costs that you need to take or incur to kind of make sure that you're healthy and staying healthy.
Absolutely. I liken it to auto insurance, quite frankly, is that I don't expect my auto insurance to pay for my oil change.
Right.
I go in every 3,000 miles.
Right.
I don't expect for it to pay for my tire rotation.
Right.
There are just general maintenance things, checkup things that, my auto insurance won't cover.
Right, we say that in the office too.
Yeah.
It's like if you went into, your brakes go out and you go to Meineke and you give me your Geico card, they'll laugh in your face.
Right, exactly.
We won't laugh at you.
No,
We won't laugh at
no
you.
laughing.
But it's true.
Yeah.
So, and so once somebody gets their initial scan, right? Let's say and they've had the reading. How often do you want them to come back? What kind of frequencies do they have?
So ideally, with thermography, because we're looking at again the metabolics, we're looking at functioning. So functioning, understand, keeps changing. It fluctuates.
Right.
So ideally, we'd want to see somebody initially, and then particularly for breast screening, would be initially, and then 3 months after that, in order to get a stable baseline, because we would want to see that the second set of images are very much like the first set.
Okay.
If there's some change, certainly we would follow up. But once we have that baseline established, that, hey, you're stable in the short term, then we'd look at longer term imaging, which would from there be once annually. So.
Okay.
So pretty much once a year, except for that baseline, which is a baseline over time, that we want, rather than just a baseline in the moment.
Right, and we were talking about this before we even started filming that, if somebody starts, at a younger age, let's say they have a history, their mom or grandmother had breast cancer, starting earlier and kind of getting a good healthy baseline, you can check that periodically, and you can kind of, you're at a better place to really, to make sure that you're not developing.
Yeah, I have had women come in my office who are in their late 20s, early 30s, and again, the family history tends to drive them to do that. They're not candidates as much for mammography just because of the density of the breast tissue. So this is a great way for them to start. And again, they can do it as often as they want. And likely at a young age, the breasts are very healthy. And so as we follow those women over time, and they go through the different changes that women go through, we can very easily assess how are they compared to when their breasts were younger.
Right. And that's interesting. I just actually picked that up right there, is that you talked about checking almost like lymphatic drainage, and that can almost, if that lymphatic gets drained, like you said, it's the sewer system, and that's blocked. Sometimes what happens is some of the fluid will start to kind of leach out, and kind of doesn't make that tissue around it very happy and healthy, which
Right.
is a breeding ground for, cancer.
Right.
And so if you can find that, early on,
Mm-hmm.
and then suggest maybe some kind of targeted massage to kind of help with that
Right.
lymphatic drainage, you're not just waiting for it to happen and then finding it and then saying, okay, well now we're too far gone. Now we have to talk about something drastic like radiation or chemo. Like you can really catch these things really early.
Yeah, exactly, because it isn't a situation of watch and wait. It's really find out that there's estrogen dominance, or find out that there's lymphatic congestion, or find out there's inflammation. And then there are any number of things that you can do to rectify that. That's the whole point of early detection with anything, or early warning, is not to just watch and wait for it to get worse. It's to, let's do something, let's take some action that will resolve this. And I've definitely seen it with this very special type of massage called lymphatic drainage. I've seen women I see them at 1 month, and they're heavily, there's a lot of heat in the armpits, I guess that's the easiest way to say it, with the lymphatic congestion. They'll go for 3 or 4 sessions, see me at the end of 3 months, and that has been completely resolved.
Yeah, that's
so
amazing.
It works. You fixed a problem. You found a problem that they would never know existed.
Right, until maybe later on when they find, like a mass or something. Yeah. So, anything else that you want to share?
Yeah, so, we did talk about the frequency of it. And, again, it was interesting that I found out about it through my chiropractor, because I know my chiropractor did a thermal scan many years ago, and I'm your patient now, and Dr. Clint did a thermal scan on me. So how would you like to talk about just this connection, using heat to sort of find out what's going on in the body?
It's funny because you and I sat down and we were trying to figure out what we were going to talk about, in the video, and obviously it made sense to talk about thermography. And then I'm like, oh, I can just talk about how we use thermography. Like you were saying, if you get a cut, you kind of feel it, it's warm, and we use temperature to kind of gauge how we're functioning on, a daily basis. Even if you're a parent and you have a child and they have a fever, you're checking the back of their head, or you're doing a temperature. Even if you're trying to become pregnant, you're trying to see when you're ovulating, you might do like a basal temperature in the morning, things like that. And so we were talking about how even way back when, like Socrates would actually put like mud on the back of people's spines and see where it would dry up first. Yeah, because people I scan their spine and they're like, whoa, this must be something new. And the application of the technology, well, the technology is new, but the application is not. People have been using heat to see where there's inflammation or problems in the body for a long, long time. And so what we do in our office is we use a device called computerized spinal thermography. Basically, chiropractors, they weren't putting mud on people's backs. They were just using the back of the hand, and wherever there was more heat, they kind of figured that was an area where there's a subluxation or a bone out of alignment, putting pressure on the nerve. And so they actually started, there was a patient actually in the 1930s called Dasa Evans, and he was an electrical engineer. And he asked the chiropractor, he's like, instead of using the back of your hand, he's like, can I make you a handheld device to kind of measure this? And he would scan up the spine, and wherever there was a heat differential, like the needle would move, and then they would actually mark it with like a skin marking pencil and keep going up the spine, and then go back and adjust. So, but I don't write on my patients anymore. We use it's computerized, and it's reading heat differential. So the difference between the left side of the spine and the right side of the spine. The vertebrae can actually misalign. It can interfere with the nerves that branch off. And that can be a problem because your nervous system controls the functioning and healing of your entire body. So we can see the chart behind me. The brain branches off, and it talks all through the nerves, keeping your body healthy. And so any interference, if that is left long enough, turns to dysfunction. Dysfunction leads to disease. And so one of the simple ways is just scanning the spine and seeing where there's some heat on that area. And if there's some heat, we can do a postural assessment, we can do a little bit of a health history, figure out what's going on there, and then work to correct the misalignment in that area and take the pressure off the nerve. And so, it was really interesting that I didn't think that I would be talking, about the thermal scan in this video, but it's like, it makes sense. Like we're both using thermography, we should be talking about it.
Yes, no, exactly. And what I love about this whole technology is that the body is constantly giving off a message that of its health or lack of health. And one of the ways it does that is with heat. And we've mostly overlooked the heat. We're waiting for pain to tell us that there's a problem. But long before the pain, as the body is becoming less healthy, it starts to send out a signal, and that signal is a heat signal, and I call it, it's throwing up a flare saying, pay attention to me.
Yeah.
And whether we pay attention or not, that's the key. But it's easy to pay attention with thermal imaging like I'm doing, or the thermal scan that Dr. Ben is doing.
Right.
At least you can, hit that subtlety, that subtle message. That's really what it is.
Yeah, and it's true, and it's great that we can. That really is, I think, probably one of the first warning signs, and it can be easily overlooked, especially if you don't have the technology or to look at it and to measure it and to see what's going on. Most Americans wait for symptoms to come about, kind of wait and watch. And I was reading something, and they said by the time you're already experiencing symptoms, sometimes the disease process in your body can be advanced by as much as like 40%. So when we sit and we wait and we're like, well, I always talk about the World Health Organization, their definition of health is the state of complete physical, mental, and social well-being, and not merely just the absence of sickness and disease. And that's so important, because if we just wait, and a lot of people judge their health based on how they look and how they feel.
Right.
And they're missing all these little subtle clues. So these technologies that we provide can give you a good insight as to what's going on before there's problems.
Exactly.
Well,
before they've manifested. I think the problem is there.
It's there.
It's just not able to be felt or seen or heard. But to find it at a subtle level, you have so much more potential to fix it than if you wait until the wheels fall off, as I call, when you're in such crippling pain, or these worst case scenario situations. But if you can do something before the wheels fall off, you have a much better chance.
They say an ounce of prevention is worth a pound of cure, or something like that. It's much easier to take care of a problem before it becomes a problem, really.
Definitely.
So, I really appreciate you coming over today and talking to me, and of course. And so I know we want to have another video, because Ingrid was telling me about she can use this actual device to do full body scans, and one of the biggest ones to me, my dad's a diabetic, and I know you told me about like looking at the hands and how you can almost do like pre-diabetic levels depending on what's going on. So we were going to kind of throw that in the video today, but before we started, we thought it's so big of a topic that it deserves its own video. So look for that. Ingrid will be back. So thanks for watching, and share this with your friends, family members, because this stuff's really important. And like our Facebook pages, and you can direct message either one of us, and we'll try to help you guys out, find you somebody in your area that can help you. And if you're in the greater Portland area, certainly we'd be happy to talk to you too.
Absolutely.
Anything you want to add?
I cover a lot of Maine too, so
yeah,
these guys don't travel, but I do.
No, I don't travel. All right, thank you so much for watching.
Thanks, everybody.
Bye.
Bye-bye.